Okay, I guess I'll start this over. Seems to be messing up a little bit. Again, my name is Lily Rose, and I would say about maybe 5 or 6 years ago, I walked into my OB doctor's office for just a regular checkup. I did hair on my face, on my cheeks, my chin area, and first thing he said was, "You have PCOS." I said, "Okay." He didn't run any type of test or anything. Didn't tell me what to do, as far as to control it, what type of diet plan to go on. So I was basically just left on my own to just figure out what to do my own research. Um, at the time, there wasn't really that much research out there that anyone had done that I could find. So I just dealt with it. I tried diets, no type of diets would work. I would lose maybe first 10 pounds, and that was it. I kept trying. My problem area was my midsection area. Excuse me. The doctor told me, when at that time when I went, he told me that I will not be able to have any children. And I told him, I said, "Well, I already have one child." And he's like, "Oh, okay. Well, I guess it was just like, it just happened." I'm like, "Yeah, pretty much." So, um, now up here, back up here, present time. Um, I made a doctor's appointment for Tuesday to go see an OB doctor. I went in, brand new doctor, never seen him before. Went in, the nurse took my vitals and whatnot. My blood pressure was good. I was telling her the issues that I was having. Again, I let the hair grow out of my face. I let her know that from time to time it felt like my sugar would drop and I'd have to take something to get it back up. My periods would be extremely heavy. Um, I'll have really, really bad clots, and it was excruciating pain. And I was telling her that about when I went to the doctor at first years ago, and he was telling me that I had the PCOS because of the hair and whatnot on my face. So she's like, "Okay, well, he's probably going to want to run some tests on you, to confirm everything, and I'll let him know." I'm like, "Okay, fine." I get dressed, get my clothing on for the doctor to come and examine me. He walks into the examination room and he's like, "You don't have PCOS. Your issues is coming from your weight. It's because you're obese. Your periods are heavy because you're obese. Your sugar is dropping because you're obese. The hair is growing on your face because you're obese. PCOS is not an ovarian issue, it's a metabolic issue. It has nothing to do with your ovaries." So he didn't run any tests on me, and he was like, "Have you thought about getting gastric bypass surgery or maybe lap band? That would help you out a lot. If you go ahead and do that, then you won't have any more issues that you're having now. You won't have any more issues with your period being heavy. You won't have any issues with the hair growing on your face." And I just felt mortified. Like, even right now, just talking about it, it's really, really emotional. I told my husband about what happened. He's like, "Well, you just need to go get a second opinion." And it's like, I almost don't want to go to another doctor for a second opinion, because it's like they take one look at me and say, "Oh, you're having this issue because you're obese." And that's not the case. Like, I know women who are half my size that are going through the same things that I am. So if you were to walk into the office with them, what would you tell them? Will you tell them the same thing you're telling me? I don't think so. So it's like, he didn't even try to run any type of test on me to confirm anything. He was just like, "All that's coming from because you're obese." The nurse, she had me, pee in a cup, and she took some samples of it, and she was like, "There's no protein in your water, there's no sugar in your water, so you're good." And I've told her plenty of times when I have gone to the doctor that they tested me for my sugar and diabetes, and everything comes back, said I don't have it. But I told her that with the PCOS can sometimes act as if someone have diabetes. And the doctor was telling me that he was like, Some of this is insulin deficiency. Your body's rejecting the insulin. That's because you're obese. That's why your body's rejecting the insulin. It's got nothing to do with that. You don't have PCOS. So, like some of the stories that I've read where women have gone to the doctor and the doctor have told them that, I'm like, I can't believe a doctor would do something like that. But I experienced it. I've dealt with it firsthand. It's like, I'm not going to sit here and take myself through all that. I'm not going to sit here and let all this hair grow in my face, making me feel self conscious about it, just to say, hey, it's just growing on my face because, can you just give me something for it? And he was like, well, I can put you on birth control to maintain your period. My periods are regular, they're just extremely heavy. I have these blood clots. So it's like, we talk about that. But it's like he didn't even want to talk to me about that. Only thing he kept talking about was gastric bypass and lap band surgery. He was like, "You really need to go and talk to the doctor across the street. They specialize in that, and they can set you up real good with someone and get you set." And I was like, "That's not that didn't even cross my mind to get that. I don't want to get that. I don't want to go through that. I want to be able to sit here and lose the weight on my own with a diet plan that's going to work for me. I need to be tested for this. Is I've read up on some medications that you can take that would help out. I'm asking him about that. He's just really not giving me the time of day. He just kept basing it back off on, oh, it's because you're obese. So if you lose the weight, you can add 20 more years to your life. Like, I know all this. I don't need you to tell me the obvious. I need you to give me the test that I need to take. I need to get something to help with this hair growth on my face. Why are my periods so heavy? Why is this going on? But you're just telling me it's a metabolic issue. It's not an ovarian issue. And my thing is, if it's not an ovarian issue, then why is it called polycystic ovarian syndrome? Wouldn't it be called polycystic metabolic syndrome? But you're just not going to give me the time of day. You're just not going to sit here and give me the test that I require to get this thing and nip it in the bud and help me out. You just want me to go get this gastric bypass surgery or this lap band surgery. Nobody wants to just get under the knife just because. That's not something I want to do. I've had two cesareans with two beautiful children. That's the only scars that I need. I don't need any other scars, especially when I just need some help in the right direction of where to go, what to do to get this thing under control the best way possible. I mean, I've seen that there's really no cure for it, but you could control it to the point where I want to be able to go out and say, do I have to shave my face today? No, I should be good. Do I have to get some type of cream to lighten my skin where the hair grows on my face? I shouldn't have to worry about those things. I shouldn't have to go to the store and look at different hair removal creams and try the cream and this cream doesn't work and this cream doesn't work because I've tried Nair um facial remover and it just irritated my skin so bad. So now I just have this electric razor that I use like every other day. I have to use it. Like I used it on Tuesday when I got back from the doctor. Um, right now I have stubble right here on my chin, on my cheeks, and underneath my chin here, it's stubble. Um, it's self conscious, Um, like even when you take it off, you can still can tell where the hair is or where it's been or where it's about to grow back because it gets dark. You have that 5 o'clock shadow right there. Like even now, I can tell that I'm going to be coming on my period in a couple of weeks, maybe a week or so. And it feels like my body is just trying to struggle to get it to come on. And it's just going to be so painful. It's like I don't look forward to it at all. I don't look forward to it. So that's my story with PCOS and doctors. And hopefully my journey could get better. Thanks. You have a great day.